I'm Sam Shovers, and I worked with Jessica White this summer at St. Christopher's Hospital for Children through Bridging the Gaps. So I'll tell you about our agency and also our summer project. We just want to quickly thank Dr. Renee Cottenham, Drs. V. Gellis, our academic preceptors, and our community preceptors, Katie Feehan and Dr. Renee Churchill.
So our community partner this summer was St. Christopher's Hospital for Children, and specifically their Center for Children and Youth with Special Healthcare Needs. This is a pediatric primary care center for children and youth with special healthcare needs such as medical equipment needs, autism spectrum disorder, intellectual disability, physical limitations, and more. The center also includes special programs such as an autism screening study, Down syndrome program, transition to adulthood program, and dental services. The project that we worked on included two components. The first one was St. Christopher's Back to School Carnival. This carnival is an annual carnival that's usually held in person, but unfortunately due to COVID-19, we had to transfer it to a virtual format. So our virtual carnival included online tents for games, entertainment, health, resources, and food. It also included live Zoom events for patients and their families to participate in on the day of the carnival, and pre-recorded videos for safe and fun activities that patients and their families can do at home.
Another really awesome component in the past for the Back to School Carnival, and something we continued this year, was our school supply drive. So we were able to collect close to 10,000 backpacks through donations, primarily to hand out through a socially distant drive-through to children, and the backpacks are full of school supplies, food, snacks, games, activities for families and children. And we also included resources particularly surrounding oral health and access to information, resources, treatment. So kind of the final project of this summer, as you could probably guess, is the carnival itself, which will occur on August 14th, 2020 at stchristopherscarnival.com. It's going to have 6 different tents, as you can see here, through live programming, games, and also pre-recorded activities. The one I really focused on was the games tent, so trying to figure out how to do carnival-style games, but at home, and it was really cool that figured out how to kind of repurpose some household items so children of all different ages can participate with various difficulty levels. And I created written and video instructions so all children should be able to follow along and participate.
I worked on the autism-friendly activities, resources, and booth this summer. So in the autism booth, we had experts that recorded specialized videos on topics like feeding, toilet training, and wearing a mask. We also had pre-recorded videos where we read social stories that explained COVID-19, as well as resources from community partners that serve people with autism spectrum disorder in the community.
So just kind of reflecting on what this summer meant, I think about the storytelling project, and that kind of centered around a qualitative narration with a bunch of staff at St. Chris to kind of find out what the heart of St. Chris meant. And the 3 tenets that appeared the most were commitment, dedication, and pride. I have this quotation at the bottom that just kind of summarizes the uniqueness of St. Chris and their commitment not just to serve their patients, but to really connect with them and see them kind of as people, families, community, and going above and beyond the typical relationship at a hospital.
So in my reflection, I thought back to a question I had at the beginning of the summer, which was, what difference could adapting the carnival to a virtual format make? So despite the difficulties that were presented by COVID-19, the hospital still found a way to provide the St. Chris community with a summer carnival. So even though the idea of the virtual carnival is hard to grasp at first, in the end, we had distribution of resources for the community. We provided school supplies, snacks, and entertainment to families. We also improved the morale of the community in these frustrating and unsure times. So I learned that finding ways to connect with the community is possible even when being in the same physical location is unsafe, all thanks to the technology and efforts of dedicated individuals.